Can you hear me? You can reply. I can proceed.
Yes.
I can see very few students have joined. So shall I wait for the students or I start? What is your suggestion? Tell me. I'll follow. Okay, have you started your revision? All the modules are done, right? So have you started your revision yet?
Yes.
Mm, I can't hear. Can you please talk a bit louder? I will really appreciate that if you can try. Okay, so you guys are having your revision classes, right? All the subjects have started revision. So my query is, have you started revision by yourself or only we are having revision in the class? Like at your home, are you doing revision before coming to the class or after finishing the session?
Yes.
Okay, that's
Yes.
very good. Very good. So do you have any plan for the revision? When is your exam?
July.
You know your exam schedule, right? So do you have any plan for the exam? How many have plans for the exam? Any schedule, any routine? Okay, if you don't have any study plan yet, you can start preparing that, because if you have a like very structured study routine, it will help you to save your time. And this is the time you don't have enough time to study everything. Okay, so whatever you studied, you have to revise now again and again. This is the plan for the revision. So you plan for every module. When you think that I have to study all the module at one shot, it might be very overwhelming. You will not feel good that year one I have studied this, I don't remember. It is very common for all the students. So you are not in this path alone, but you have to start it. How you will start? You make a plan. So I have 7 modules, 8 modules. I will plan 1 week for each module, or I will plan 10 days for each module if it matches with your timeline. Okay. Then you revise the modules. First you revise by yourself. Then you do the questions. Then you revise with your friends. Okay. It can help. Now the new learning will you cannot remember. If you can remember, you have to like for that you have to put more time. This is the time you have to learn and revise the contents that is already covered. Okay, and practice for the OSPI, practice for the MCQ questions. Because by attempting MCQ, there is a high chance you can get more marks. So plan for that. And already you have attended all the modules, so you have the idea how the question may appear, right? Okay, so I can see that the attendance is bit increased now. So I'll start my session. Just tell me if you can see the screen. When you tell me that you can see my screen, I'll start it. I was thinking that how can I plan for this session to make it more convenient and easy? First, I thought I will show you some PowerPoint slides. I prepared that also, but then I think again I thought every time you might have seen so many slides in other revision classes. Just last minute, I decided to give you some quiz. So this is a quiz you can see now. So if you have device, you can plan for this. Uh, can be ready. I'll start now. I just want one or two replies from you guys that you can see my screen.
Yeah,
Okay.
you can see.
Okay, good. Very good. If you cannot answer all the questions, no problem. By attempting and by joining, by participating, you can learn some. Is there anyone? Okay, are you guys there? Are you in hostel or at home?
In info. Who?
Okay, good. Okay, we'll start now. So, have you started your revision for the pharmacology topics, especially endocrine? Wow, that's very good. So, yeah, 50% you revised already. That's very good. And I can see that one student will start tomorrow. I really appreciate you, a student who is planning to start today. So, this is a good initiative you're thinking. Okay. So, from endocrine pharmacology, we'll start. From the endocrine, there were like 4 lectures covered. I will cover the corticosteroids. I taught corticosteroids. So from there, in endocrine module, end of module, you have attended questions, right? So like basically, we ask what are the roles of glucocorticoids. Glucocorticoids usually have 4 pharmacological effects, right? They have anti-inflammatory effect, immunosuppressive effect. What are the other effect? Can they suppress cancer? Yes or no? Can they suppress complement system? So there is a pathway. If you answer this, you will learn how they are exerting their pharmacological effects and what are the pharmacological effects are responsible for this. So this image you can see here, this is very important and basic image you must know. Okay, so inflammatory stimuli activate the arachidonic acid pathway, and you can see there are different enzymes releasing because of the response of the injury or inflammation. Okay, so my question was, what was the enzyme that was releasing? So most of you have attempted the right answer. Yes, it is phospholipase A2. The others that like cyclooxygenase, yes, cyclooxygenase also right. Lipoxygenase, thromboxane synthase, all are the enzymes responsible here. But if you think about the first enzyme that is mainly causing the initiation of the pathway, that is phospholipase A2. The later one, cyclooxygenase, is coming after that, then lipoxygenase. So when the enzyme phospholipid is there, it can activate cyclooxygenase and lipoxygenase. And from the cyclooxygenase pathway, there will be thromboxane synthase. So all the enzymes are there. But which one will be the correct answer? Phospholipase A2, because this is the first enzyme that was releasing. Okay. So if I show you this type of question, definitely I will ask that what is the first enzyme, or there will be some marking if there is any OSPI question, so you can easily understood. We'll go to for the next question. I don't want to show any scoreboard, okay? Because this is for learning purpose. We are not going to judge anyone that who is having the first or second position. Okay, so if a patient with 35-year female with rheumatoid arthritis is prescribed prednisolone, it can suppress rheumatoid arthritis by having its anti-inflammatory action. So as you see in the previous image, there are so many inflammatory mediators released, right? All these inflammatory mediators can be suppressed by the glucocorticoids, and prednisolone is one of the example of glucocorticoid. Can you tell me prednisolone can be administered in which route of administration? What is the route of administration for prednisolone? Is there anyone can answer? Prednisolone can be given in which route? Oral, intravenous, or inhalation? How? Commonly, we give orally.
Oral.
Yes, very good. Orally, and if I'm asking that if a patient with bronchial asthma, I want to prescribe glucocorticoid, inhalational route. So which one will you prescribe for the inhaler?
Dexamethasone.
Yeah, come again, please. I can't hear.
Dexamethasone.
Yes, very good. Piclomethasone, fluticasone, these are the very commonly prescribed drug that we use for the inhaler. Okay, so for this question, you have chosen, most of you have chosen inhibiting phospholipase A2. This is the correct answer. So initially, I have shown this enzyme is responsible for the causing of releasing of all the inflammatory mediators. Now you want to stop the inflammation. So what you have to do? You have to stop the enzyme responsible. So if you inhibit phospholipase A2, all the enzymes and inflammatory mediators at the beginning, it will be stopped. So which drug can do that? Glucocorticoids. Some of you have chosen cyclooxygenase, right? Inhibiting cyclooxygenase also you have chosen. Do you think that cyclooxygenase can be stopped by glucocorticoid? Yeah, it can be stopped, but if phospholipase A2 is there, this will be the most correct answer. So here I have asked you to choose the most correct answer. So you have to choose phospholipase A2. So for inhibition of the cyclooxygenase pathway, there is another specific drug. Do you know that? What is the drug that can specifically block cyclooxygenase pathway? That drug also have anti-inflammatory action. That drug can reduce pain. Do you know the drug name? I repeat my question again. What is the drug that can inhibit cyclooxygenase enzyme? Or what are the groups of drug that can inhibit cyclooxygenase enzyme?
NSAID.
NSAIDs, non-steroidal anti-inflammatory drug, right? Okay, thank you for the answer. Okay, so also we can see here there is another enzyme I'm showing, thromboxane A2. This is also responsible for the aggregation of platelet. Okay, so if you give aspirin in low dose, like 75 to 100 milligram low dose, it can inhibit thromboxane A2. So by attempting this one quiz, you have learned three drugs mechanism of action, right? Okay, we move on to the next quiz. Before that, Those who have attempted like the cyclooxygenase thromboxane, is it clear to you now? Can you understand what would be the right answer? Anything,
Yes.
any like emo, I got one. Anything is okay. If you say, I will understand that it is helpful for you. Okay, thank you. Now I move on to the next part. So a woman with systemic lupus erythematosus is treated with high dose of glucocorticoids, and it can suppress the symptoms. Okay, so which mechanism are you thinking that is responsible and helping the patient by giving steroid? The percentage of attendance for this quiz is less, but it's okay. You can think. So, like I can see that suppression of T cell activation. Usually, if there is any inflammation, the T cell number of T cells will be more there. Okay, so if you give this group of drugs that can suppress activation of T cell, so that is needed, right? We don't want inflammation there, and we don't want the sign symptoms to aggravate. For that, if you can suppress the T cell, it can help. And cytokine release, it will be inhibit, not enhanced. Okay. And then suppression of mineralocorticoid receptor. This answer is wrong answer because mineralocorticoid receptors are not like suppressed by this group of drug. Okay. For that, there is different group of drugs mentioned. So those who have answered suppressing T cell activation, this is the right answer. You have to remember that these drugs have anti-inflammatory action. So if you see, is there any pathway that is inhibiting the inflammation, you have to choose that one. Okay. So we move on to the next part. If you see any students are joining, please allow them because I cannot see their name. Please allow them. Okay, so you have given a patient for glucocorticoid for long time. If you give the patient glucocorticoids for longer time, it can have short-term adverse effect and also it can have long-term adverse effect. So always check before answering. Is it long-term adverse effect asking or short-term adverse effect asking? Okay, so this is the trick for the question. You know the adverse effects. Maybe all the answers are adverse effect, but choose which one have like short term, this word is there, or long term. So if you give glucocorticoid, it can cause some short-term adverse effect. For example, peptic ulcer disease. This can be the short-term adverse effect. Okay. Aggravation of the infection. If there is any persisting infection, that can aggravate. These are the short-term adverse effect. But here I asked you what are the long-term adverse effect. So for this question, there are multiple answers. You can see, but in your exam, in your main exam, only one answer you have to choose. So those who have chosen diabetic mellitus, it is right. And also if you choose osteoporosis, this is also right. And hypertension, these are also right answer. So you can see if you give glucocorticoids for long term, what is long term? Like if it is more than 3 weeks, 3 to 4 weeks, if you are prescribing this drug, then the patient may have this type of adverse effects. Okay, and those who have chosen peptic ulcer, remember that this is for the mainly short-term adverse effect. GIT irritation, like this type of problem will be there, then it can turn to peptic ulcer. And if you prescribe glucocorticoids, try to prescribe after meal. Or along with that, you prescribe proton pump inhibitor or H2 blocker, okay, so that it can prevent GIT upset. Is it clear, guys? So we move on to the next quiz now. So now we start nervous system. Okay. So you can see here, there's a very common feature from the nervous system I am putting here. If you prescribe anti-epileptic drugs, a patient, a pregnant lady, and after having these anti-epileptic drugs, she has delivered a baby. Okay, now the baby got this feature. You can see here in this picture. So tell me what is the drug responsible for this situation of the baby? So baby is having spina bifida. This image is very familiar, right? You very common. I have shown in the lecture also. So which drug is responsible?
So there is a confusion between phenytoin and sodium valproate because both drug are causing something that you can remember from the lecture, right? So if you see spina bifida, it is because of sodium valproate. So this is the right answer you have chosen. Now I can see attendance is very less. Very less number of students are attempting. Why? No problem if you do any mistake. I'm not showing the scoreboard, right? So we are not judging that what is your performance. Please try to attempt so that you can learn more. By active participation, you can learn, right? So this is the correct answer, sodium valproate. During pregnancy, if you during pregnancy, you have to be very cautious when you prescribe any form of drug. Anti-epileptic drug you cannot stop if the patient is pregnant because it is a life-saving drug. Patient might have convulsion. So you have to save the mother and also you have to save the baby. But you cannot stop anti-epileptic drug. If you want to prescribe any anti-epileptic drug during pregnancy, what will be the choice? Do you know that? It starts with L.
Lamotrigine.
Yeah, very good. So you can prescribe that drug. And if you don't know, maybe patient is also not aware that she is pregnant. Maybe she was continuing with the previous drug. Then she can have this type of problem for the fetus. So remember this: there is a deficiency of folic acid, and it can cause this spina bifida. Okay, now move on to the next question. Now come to the phenytoin because there was a confusion in between two drugs, right? If you see a child is taking phenytoin for like long time and now the child is having some dental problem and the child is referred to the dentist. So what are the problem or what is the problem you may think that the child is having now? Yeah, this is the most easiest question, right? So yeah, the child may have gingival hyperplasia. That's why he was referred to the dentist, not glaucoma, because glaucoma, then he would refer to the ophthalmologist, right? So this is a very easy, clear-cut question with answer. If there is any confusion between phenytoin and the previous question, so this is the clear picture. If you see the picture, you can easily remember. Okay. So now very commonly prescribed drug in any form of sedation, insomnia, and even epilepsy also we prescribe benzodiazepine, right? So if you prescribe benzodiazepine, what is the most common adverse effect you will see to the patient? Yes, you are right. Uh, Very commonly, patient will have drowsiness. For example, patient was taking the drug. Uh, there are different types of benzodiazepine, right? Short acting, intermediate acting, long acting. All the drugs will have this drowsiness, common type of problem. The patient will get up in the morning and feel like sleeping, or the patient will have hangover effect. Okay, so if you are choosing the patient, like the patient is a working person, go for the intermediate acting or short acting. Okay, and if you see the patient can rest at home in the morning, then you can go for long term long acting benzodiazepines. Hypertension will not be the correct answer. Fever and convulsion. Convulsion usually we can prescribe, right? So here only the correct answer is drowsiness. Convulsion is not the adverse effect. Convulsion is the indication. Sometimes patient with convulsion, we prescribe benzodiazepine. We start treatment with benzodiazepine. So it is not the adverse effect. I hope it is clear now. Now I move on to the next question. You know that benzodiazepine can produce the action by acting on the GABA receptor. So in the GABA receptor, there is a chloride channel. So that channel can open for a long time, can open very frequently, and by this way it can produce sedation. So my question is, benzodiazepine can increase what inside the chloride channel? What is the role of benzodiazepine in the chloride channel opening at the GABA receptor? Yes, most of you have chosen the right answer. And you know, this is the demarcation between, this is the main difference between benzodiazepine and barbiturate. When you prescribe barbiturate and benzodiazepine, this is the main differencing point you should know. Benzodiazepine can increase the frequency of chloride channel, whereas the barbiturate will cause increase the duration of opening of chloride channel. That's why if you prescribe barbiturate to a patient, that will have more adverse effect, more sedation, and barbiturate can cause more like it can serve more sleeping than the benzodiazepine. Okay, this is the basic difference between two drugs. So those who have chosen frequency were right, and those who have chosen duration, this is confusing with the barbiturate. So duration will go for the barbiturate. Okay. Okay, can you follow the questions? Just a thumbs up will be also helpful. Okay, now we start urogenital module. So from there, I taught only one lecture, that was diuretics. So from the diuretic, this is a very, very common answer you should know. What is the functional unit of a kidney? Nephron, right? So in the nephron, there are different parts. In this picture, you can see. So I asked that this picture, if you can remember, you will learn all the diuretics mechanism of action. You can answer any diuretics mechanism of action. So this picture is very important. You just go back to the lecture slide and you can see that there is a nephron's picture is given by marking that which drug is blocking which part of the nephron. So from there, I asked that furosemide can block, or what is the other name of furosemide? Any answer? There is another name for furosemide, right? Anyone? Can you reply, please?
Diuretics.
Yes, loop diuretics. Good, very good. So, furosemide can be named as loop diuretics also. So, if you know that loop diuretics is another name, you can answer this question. But there is a confusing part. I'll tell that. Thick ascending limb of loop of Henle is the right answer. So if you know loop, you can choose this option. But there is another option given, descending limb of loop of Henle. This will not be the correct answer. So this is the confusing part. But you know, it is a very like common and easy question to understand. We are checking just your memory. We are not checking your application. Okay. So by seeing the picture itself, you can understand and you can memorize and apply later. Some of you have chosen collecting duct. It is not the right answer. Okay. Distal convoluted tubule also someone chosen. This is for thiazide diuretics. For the collecting duct, which drug will act there? Spironolactone. Okay. So for furosemide, thick ascending limb of loop of Henle will be the right answer. Please go back to the lecture later on and check that what are the drugs acting on which part of the nephron. This is a very commonly asked question. Don't miss it. Okay, now if you prescribe furosemide for a patient with heart failure, there is for long term you can prescribe. Okay, so patient may come with some electrolyte abnormalities. Patient may have muscle fatigue, palpitation. So if you do some investigation, you will see there are some different like alteration in the electrolyte levels. So what do you think that which electrolyte abnormalities the patient might have? Is it hypokalemia, hyperkalemia, hyponatremia, or hypercalcemia? Is there any like confusion here? Okay, most of the diuretics, remember that, especially thiazide and furosemide, they will cause hypokalemia. Okay, and only one specifically diuretics I taught there was potassium sparing diuretics, spironolactone, that can cause hyperkalemia. Okay, so most of you have chosen here hypokalemia. This is right answer. And those who are confusing with the hyperkalemia will be caused by spironolactone. You know, in the loop of Henle, thick ascending loop of Henle, there is a co-transporter. This co-transporter is called sodium potassium chloride co-transporter. So if you give furosemide, it will block the co-transporter. So sodium and potassium will not be in the body. They will be excreted from throughout the urine. So that's why it can cause hypokalemia. There was a picture under furosemide mechanism of action slide. Please go back and check. The detailed explanation is there. Okay. And if you understand, you can remember. Otherwise, by memorizing, you cannot remember this. Okay, now going to the next quiz. Which of the following drug is a potassium sparing diuretics? First one is acetazolamide, furosemide, thiazide, and spironolactone. I have answered this question in my previous discussion just now. Yes, all of you are right except one. This is spironolactone. Okay, so spironolactone is acting where? It is acting on the collecting duct. Why it is called potassium sparing? Sparing means what? What? It is retaining potassium inside our body. That's why if you give potassium sparing diuretics, it can cause hyperkalemia. Easy to remember by the name. And thiazide diuretics is causing, what are the examples of thiazide diuretics? Chlorothiazide, thiazide, both are an example of thiazide diuretics. Okay, they are causing hypokalemia. So, will you give potassium sparing diuretics alone or mostly in combination with other diuretics or with the other drugs? Any reply?
Combined.
Fine.
Mainly combined. Good, very good. Because it when we give furosemide or thiazide, there is a high chance of having hypokalemia. And if there is hypokalemia, patient will have so many other symptoms, right? So we don't want that. To compensate that, usually we give a combination. We don't want hypokalemia, so we give spironolactone. So it can balance the potassium status in the patient's body. And do you know any indication, like what are the clinical situation we can prescribe spironolactone? Okay, diuretics we are giving for what? We are giving if the patient is having edema, any fluid retention in the body. Overall, diuretics can excrete or eliminate the fluid, excess amount of fluid from the body. So, what are the disease can have this type of edematous condition? Think that we have three main organs in our body. If there is any problem in these three organs, there will be edema. So, three organs problem you can give diuretics. One is heart failure. This is the main organ, right? Then renal failure you can give, but you have to be very cautious. If the renal failure is very like severe, all the diuretics cannot be given. Only furosemide we give. Then if there is an hepatic failure, also there is edema, right? So easy to remember. By this way, if there is edema caused by the main organs of our body, we can prescribe. But you cannot answer. You have to be careful while answering because heart failure can be different types. If there is heart failure, left ventricular heart failure, then patient cannot breathe. There will be edema in the lungs. Pulmonary edema it is called. So you have to immediately relieve the patient by giving furosemide. Okay. If the patient is in emergency condition, you give furosemide IV. If the patient is okay, like stable, then you switch to oral. Okay. So these are the indication. Very basic life-saving indication we need to know. Furosemide is also called furosemide got another name. Do you know that? This is very high efficacy drug. Even the patient have renal failure, other drugs are not working. In that case, also if you give furosemide, it can save patient's life. Okay, for the renal failure type of patient, you cannot give so many drugs because it will be accumulated in the body and it will have some other toxicity. Because of renal failure, patient may have toxicity already, and by giving any type of drug, it can aggravate. So all the drugs cannot be given in a patient with renal failure. But this is a safe drug for the renal failure patient as well. Okay, I hope you can follow what I am discussing. Please try to focus. These are the very commonly asked questions. And it is a very must to know at this level. Please go through this and study. And if you feel like that too many contents are there, always you can reach us. If you have any doubt, you can reach us. Any queries, any topic you want to have further discussion, you can have a time or schedule from the lecturers. If you have any queries from pharmacology, you can ask me. Okay. Um, and please make a time or appointment. Then I can explain it again. If you find that it is, I want to know further. Okay, I am not very sure about the discussion. You can ask that. And also, now this is the time for you to revise. Revise again and again. Okay. So this was the last question I showed. Now there is another question. With that, I'll end. So what do you think? What is the like success in your first professional examination is achieved by how? What is the specific measure you should take for your to pass your in your first professional examination? You can choose multiple answer here. Okay. Yes. So you have to revise repeatedly, right? This is the must thing. There is no alternative than study. There is no shortcut in life, you know. The moment we plan for shortcut, things will be too much complicated. So don't plan for any shortcut. Only thing you do, study and also repeatedly, revise repeatedly. And before that, you make a structured study plan. If you find that I have difficulties in anatomy, you put more time in anatomy. If you think that I have difficulties in physiology, put more time. Different students have different difficulties for different subject, right? That you have to find out and put more time for that. Choose the morning slot for the difficult subjects. Okay. If you think that no, I can study evening, then you choose your evening time for the difficult subjects. Use your most like active time for the difficult subjects. Then you practice more questions. You know, there are so many apps now. You can choose that and you can just upload your study material and you can find questions from there and you practice repeatedly from there. Okay. And if you think that today, this day is not very active, maybe I cannot study in the afternoon, I feel sleepy, you go form a group. In this group, you study. Okay, so all the questions and answers are correct here. Okay, to pass successfully in your, what is your outcome? Like, what is your goal? Pass the exam now. For now, you have to pass the exam, right? And also, not only pass, you have to remember this so that you can apply this in your year 3. For that, you have to follow all the 4 strategies mentioned here. Okay, please try this, and I hope it will help. Is there anything you want me to share now? Any topics you want to discuss further, I can do that. Or if you want to study by yourself now, this will be the very like timely decision. So if you think that I have time now, I can go for one more topic to discuss. Or if you think that I will study by myself, that you can also do. So how many have attended the quiz? I can see the attendance is more now. Okay, Alia, could you follow the lecture? Not lecture, it was not lecture. Could you follow the discussion? Yes. Mm, okay, yeah, you might have attended the ILS, right? So if you go back and revise the ILS, that will also help you for the preparation of first prof exam. Because in the ILA, usually you get a scenario, right? You get a patient with different symptom scenario. After that, you are learning the anatomy, physiology, and all the basic subjects you are learning from there. Then you are learning the management, investigation. You can revise your ILA materials as well. Okay, so this is the end of my discussion. I will not hold you for a long time because this is the time you should study and you can come up with the questions. Okay, all the best for your exam and take care of your health as well. Okay, okay, thank you for attending the class. Bye.
Thank you, Doctor.
Thank you,
Doctor.
doctor. Thank you,
Thank you,
doctor.
Doctor.